So students, today's topic is the endocrine system, and so you should have that set of notes in front of you. The things that we'll be talking about is we will look at the pituitary, thyroid, parathyroid, and adrenal gland. We will focus on the pancreas, which is a part of the endocrine system, with the next lecture, which is on diabetes. So as we begin this lecture, let me tell you that this is an area many of these tests you will not see unless you're in a specialty area such as working with adolescents, where we're looking at children who may not go through puberty as well or as normally as they should. It would be in reproductive medicine, so women who are having fertility problems. It may be in a special area called endocrinology, and that would be something that in most cases would be dealt with out of the hospital in a physician's office or a practice. We do see some of these tests from time to time on hospitalized patients, and I'll kind of explain those settings as we go through this lecture. So to remind you of where these were located, this should be a review from your anatomy and physiology class. You have your thyroid gland, which is located in your neck. Your parathyroid glands kind of sit on top of those in close proximity to the thyroid. We'll look at the pituitary gland and some of its functions in the body, and it's really a P-shaped structure that's located up in your cerebral area. When we go to the adrenal glands, they sit like little hats on top of your kidneys. And we won't deal a lot with the ovaries and testes, but obviously we'll be talking about how these things work together. And so our focus today will be pituitary, thyroid, parathyroid, and adrenals. So the endocrine glands, their main job is to secrete chemicals, and in many cases they work together to do their job. So in some cases, and we'll talk specifically about the thyroid and pituitary and how they work together with things like Thyroid-Stimulating Hormone. So in many cases they work together, and in most cases they transfer their chemicals through the blood to the area where they need to work. This is not something you have to memorize, but I find it helpful because you may have heard of some of these medications or supplements. There are three primary types of compositions of hormones that are produced by the endocrine glands. They fit into the category of steroids, and these steroids would be both the anti-inflammatory steroids and those that participate in production of estrogen or testosterone. So the ones that we hear of weightlifters or bodybuilders using, that gives them things like complications like steroid rage or roid rage. So these are both the anti-inflammatory and kind of the muscle building or masculinizing and feminizing type of hormones. There are hormones that are proteins or polypeptide based, and those are things like insulin. I bet you've heard of that. Oxytocin you've heard of if you know someone who's had labor induced. We give a drug called Pitocin, which is oxytocin, and that causes a woman to have muscle contractions in the uterus and leads to labor. So sometimes a woman's post-term and we want to have her go into labor. In anatomy and physiology, we talk about antidiuretic hormone and calcitonin. And here's another example of a hormone that or a protein hormone that is working with another gland. Calcitonin is released from your parathyroid gland, and it travels through the bloodstream to the bone to tell the bone or the teeth to release some of their calcium into the bloodstream. Amines is the third category of hormones that are produced by the endocrine glands, and that would be things like epinephrine and T3 and T4, some of those thyroid hormones that we'll talk about later. So the primary functions of the endocrine gland are to help maintain balance in the body, and that's what this term means. It means for the body to try and be in balance. As I mentioned, this would be an area of medicine that would be in dealing with growth and development of children, so babies, and in growth and development of adolescents. They would be reproductive issues. The endocrine glands play an important role in energy metabolism, so setting the basal metabolic rate, how fast you burn calories or how fast you don't burn calories. They also affect mood and behavior, so you can think back to that, like roid rage again. Let's start with the pituitary gland. So in your notes, I start with that also. And the pituitary gland then is located right there at the base under the cerebrum. So we have it located at the base of the brain. It's attached to the hypothalamus, so it's in that area of the brain. And the main thing that it's responsible for, the important hormones that we'll talk about, will be growth hormone, thyroid-stimulating hormone, some that affect reproduction then, and some that affect saving of water or removal of water. So as we go through this list, some of these should be familiar to you. Anti-diabetic or diuretic hormone. Diuresis is peeing, basically. It's getting rid of fluid. So if I have a hormone that causes anti-diuresis, that should make me save water. Can you think of how the body might do that? Remember the electrolyte lecture, and we said certain things can make the body save water. So anti-diuretic hormone is going to work with the kidneys to cause them to save sodium and to save water. Oxytocin, I spoke with you about how it plays an important role in inducing labor. It's also important, and it's a shot that they give women who have delivered a baby. It causes those uterine muscles to contract, and that would stop the bleeding that's associated postpartum following a delivery. We have growth hormone. So if we have a person who's growing too much or not growing enough, we might look at studies to evaluate their pituitary hormone. And these are things we could measure directly in the blood. We could measure the level of antidiuretic hormone. We can measure the level of growth hormone. We can measure follicle-stimulating hormone and luteinizing hormone. So these were things that you usually talked about in a reproductive section of anatomy and physiology. The pituitary, even though it sits way up in the brain, it plays part of a role in reproduction and fertilization. Prolactin, I bet you can determine what that would be. Remember, there's lactation. So prolactin is a hormone that would actually cause you to start having milk in your breast. And it would be a hormone that they could give people who have adopted a baby so that they could actually breastfeed that baby. There are some people who choose to do that. And so we could artificially make the body think the woman has delivered a baby. And using this hormone, we can make the breast produce breast milk. Melanin stimulating hormone. Remember, melanin gives the pigment its color. Things like freckles are high in melanin. So if we have problems with the pituitary gland, if we have increased melanin stimulating hormone, what do you think that would do to the color of your skin? Or what kind of patches of skin might occur? So we might have dark patches that would start to occur, and we'll have some other ones that affect different pigment of the skin. So let's look at growth hormone for a minute. What if we have someone who's growing too much or they're not growing enough? Wouldn't that seem to be a good thing? Well, growth hormone does more than just affect growth. It stimulates fat breakdown. So can you imagine there might be people using growth hormone to lose weight? And I'll bet if you watch commercials on TV for supplements, you see things that are aimed at this. Growth hormone affects cell number, especially in muscle and bone. So if I had growth hormone before I went through puberty, it could cause my muscles and bones to be larger. What if I go through puberty, or what if I've gone through puberty and then I have an increased production of growth hormone? Maybe because I'm taking something, a supplement, or an artificial hormone. Or what if it's because I have a pituitary tumor that's pressing on that area and causing my pituitary to release more growth hormone into the system? So we have some patients to look at here, and if you look in your notes, it talks about different conditions towards the end of each set of endocrine glands. And with your growth hormone, it talks about patients who might have excess production of this, or patients who might have decreased production of growth hormone. And so if you produce too much growth hormone, If you've gone through puberty, it results in a condition called acromegaly. So acromegaly is caused by increased secretion of pituitary glands, such as growth hormone, after the body has gone through puberty. Because the bones could not get longer, they would get larger. They would get thicker. And so acromegaly usually results in someone who has thicker bones than normal. That could involve bones of the face. So your face might actually start to change. Those bones, imagine the bones in your skull getting thicker. They can't grow longer, but they could get thicker. So, and then we see some different pigmentation on this person's hands too. If we could see a nice clear picture, there would be darker areas of pigment. Thyroid-stimulating hormone is a hormone produced by the pituitary gland, and thyroid stimulating causes other hormones to be released from the thyroid gland. So TSH is a blood level we could measure. We could also give you TSH. It's going to act on the thyroid gland, and if the thyroid gland is capable of releasing its hormones, then we would see those released into the bloodstream, and you would have increased basal metabolic rate. This last statement says there's a negative feedback system that is involved in regulating levels. So I want you to think about this carefully then in reference to this statement. If a patient had elevated thyroxine and triiodothyronine, so I want you to try saying those, okay? Are you ready? Thyroxine and triiodothyronine. I bet it's not easy for you to see why we shorten those to T3 and T4. So we can measure T3 and T4 levels in the blood. When thyroid-stimulating hormone acts on the thyroid, it releases T3 and T4. What if somebody has elevated T3 and T4 levels because of a thyroid tumor? This statement says what would happen to thyroid-stimulating hormone. So a negative feedback mechanism is also involved. If T3 and T4 levels are high, what do you think would happen to the level of thyroid-stimulating hormone? And I'll bet that will be an important thing to think through. Maybe a quiz question might even be on that. Another hormone released by the pituitary gland is antidiuretic hormone. And when someone does not have sufficient antidiuretic hormone, or they have an inappropriate amount of it, I see a notation in the patient's chart that says SIADH. And that stands for Syndrome of Inappropriate Antidiuretic Hormone. It may mean they have too much or they have too little. There's a condition called diabetes insipidus, and I had that on a previous slide. Diabetes insipidus, a person produces a lot of water. And this is on the bottom of page 1 in your notes. It talks about a person who has large amount of urine, up to 20 to 30 liters per day. So our first clue that this might be happening is that someone doesn't just produce normal amounts of urine or a little bit increased amounts of urine. They produce what we call buckets of urine. And it may tip us off to the fact that their pituitary is not releasing antidiuretic hormones such as it should. So antidiuretic hormone causes the kidneys to save water. Antidiuretic hormone is also known as vasopressin. And if you think about blood pressure and blood vessels and how they work together to maintain blood pressure, if I were to cut my arm off and start bleeding to death from a major artery, my body should release antidiuretic hormone from the pituitary that will travel in my blood to my kidneys and tell them to save water to try and get my blood pressure elevated. And so the term vasopressin is an alternate name for ADH. Diabetes insipidus then is a condition where we've had damage to the pituitary in the form of head trauma or maybe a tumor that's pressing on that area of the brain. And those people may have insufficient antidiuretic hormones. So syndrome of inappropriate antidiuretic hormone, most commonly seen in head injury patients or maybe a pituitary tumor, maybe after surgery for a head lesion. The thyroid gland is the next one we move to. And I guess to wrap up the endocrine function one, the main defects would be giantism, if the person had increased growth hormone. If you look at page 1 on your growth hormone piece, you could have dwarfism, someone who's too short and small, or you could have giantism. And we talked about how if the person has increased growth hormone after they've gone through puberty, your notes mention that they might have a jaw that starts to look like it's poking out more. Their tongue might get larger, thicker. Their nose might get thicker. But, and those things may be symptoms then if someone says, gosh, you've really changed how you look. Not just a little things seem to be really different about your face. Maybe there's a problem with the pituitary gland. Okay, now we move to the thyroid gland. So this just reminds you it's located laying kind of over your trachea in a couple of different lobes. The levels that we can measure in your blood would be T3 and T4. And we've tried pronouncing those. And the primary thing that thyroid hormones do is regulate basal metabolic rate. And basal metabolic rate controls body temperature. It controls how much you burn calories or how easily you do that. So in the olden days, because thyroid hormones affected basal metabolic rate, I remember when my mom wanted to lose weight and she went to her diet doctor. There was diet doctors then. And they would write you a prescription for thyroid hormone. They would not even measure your thyroid levels. They would just give you thyroid hormones. And if you read in your notes, it talks about symptoms of excessive thyroid hormone production. So Graves' disease. And it talks about how you might develop excessive perspiration, muscular weakness, emotional instability. So there are side effects that go with these medications. Yes, you could lose weight, but you might have mood swings and irritability. And so if we think of the symptoms of someone who has excess thyroid production or too little thyroid production, I want you to think what would happen to them and how we might evaluate it. So if someone had excess production of thyroid hormone, what would happen to their body weight? If I produce more thyroid hormones and those regulate basal metabolic rate, what would happen to my weight? Would it go up or would it go down? What do you think would happen to my body temperature? Remember that heat is a product of metabolism. So if I have increased thyroid hormones in my blood, what would that do to my body temperature? What would I complain of? And I hope that you answered. If you increase T3 and T4 in the blood, you have weight loss. If you have increased T3 and T4, you usually have an increased body temperature. So, similarly, if my thyroid levels are low, my husband had cancer and they radiated his neck area because of that cancer to treat those lymph nodes. Because of that, a byproduct of that radiation was damage to his thyroid gland. It does not work like it should. And so what symptoms would he have had to indicate that his thyroid hormone levels were low? What do you think happened to his weight? So he gained weight. He was cold all the time because his thyroid levels were low. How do we correct that and how do we diagnose it? Well, you go for a procedure called a thyroid scan. This is one option. And so if someone had what we thought was a thyroid tumor, and because it's located on your neck, you could feel those. And so if you want to put your hands up on this, across your trachea, you could kind of pinch your neck between your thumb and your first finger. Just gently pinch the area of where your Adam's apple would be located. And then if you swallow, you can feel your thyroid move underneath as you swallow. And so this person's developed a tumor that could be felt from the outside. It might be visible from the outside. In a patient who has some symptoms that it sounds like thyroid, they might send the patient for a thyroid scan. So someone who's gained a lot of weight recently without an explanation or has lost a lot of weight without an explanation, they might check thyroid function. The thyroid takes iodine to make its hormones. Remember, try iodothyronine. That sounds like it would use iodine to make that hormone, and it does. So we give the person some radioactive tagged solution, and that radioactive iodine would be taken up by the thyroid gland. So we can see a nice outline of this person's thyroid, and then we see this nodule here. And we describe those nodules as being hot or cold, and that means metabolically active or not. So this lump of tissue could have been just a benign tumor that was not really doing anything. And in that case, it would not have taken up that radioactive iodine. In this case, it did. This is acting like another piece of thyroid gland. And so this is a thyroid tumor that would be considered a hot tumor. So if this person has extra thyroid tissue, can you imagine what might happen to their levels of thyroid hormones? So the symptoms of the person: I eat and I don't gain weight, I feel hot, I'm irritable, I'm continuing to lose weight even though I'm eating more. If we had a cold tumor, it could also be cancer, but it tells us it's not metabolically active. So a thyroid scan is one procedure we could do to check the thyroid. The other one, we could actually measure the levels of T3 or T4. This is how someone might look with Graves' disease. So it talks about it causes increased pressure behind the eye, and so the eyes would kind of bulge out. There are people who can do this with their eyes. That's a trick. This would be a person who has this kind of happening all the time. Sorry, let me turn that off right now. All right, with this one then, if we had a patient who, or a family member who we notice, you know, normally a person's eyelid at least covers the top of their pupil and their iris at least. Yours seem to be bulging out, and that could be a symptom of Graves' disease. If you look in your notes with Graves' disease, it also talks about the symptoms that they might have. And with Graves' disease, if you have excess production of thyroid hormones, what could we do? Well, we actually implant a radioactive pellet or pellets, and those radioactive, just like radiation destroyed my husband's thyroid, those radioactive pellets can be used to destroy all or part of a person's thyroid. So they would implant those in the person's neck, little radioactive pellets that can be kind of pushed in with a special type of needle. So the skin would be numbed. They would insert those radioactive pellets. They would give them a few precautions as far as their urine would have radioactive activity in it, their bowel movements would have radioactivity. They would be told not to be in close proximity to family members. And then eventually those would be either taken out, or they would have that half-life that they would degrade over time. And so sometimes we do want to destroy a portion of a patient's thyroid, and then we can supplement them with a pill that they would take every day for the rest of their life. And we would check those levels occasionally. Here's a condition called goiter, and if you look why this happens, we said the thyroid needs iodine to make its hormones. And so if your soil is low in iodine, or your diet does not have that, and most of us get it through foods grown in soil. If we have low iodine in our diet, we get it through salt also, I guess, iodized salt. Then you could develop a condition called goiter, which is an enlargement of that thyroid. Now, obviously, you would notice this happening, and you would usually go in for medical attention first. So we're going to assume this was a person where it happened fairly quickly, and that's a bit rare. It's that maybe they didn't have access to medical care or something. Cretinism. This is a condition that of a low thyroid hormones that happened in a child before puberty. So cretinism, it can affect bone growth. It can also affect mental development, so they could have some mental retardation due to that. They would have sluggishness, maybe increased body type, body mass. And in adults, if we have decreased production of basal metabolic rate hormones, such as those produced by the thyroid, we could have a condition called myxedema. So edema is swelling. This person has that swelling. The skin changes are because of different, remember we looked at some of those are proteins or polysaccharides. Some of those hormones are. And this would be totally reversible if we can get the person on a thyroid supplement and get them their thyroid levels back where they should be. So we would give them a thyroid supplement. So if your thyroid's producing too much, we could remove a part of it. We could radiate it. If it's not producing enough, we can give you thyroid hormones. Okay, now we move to the parathyroid glands. And the parathyroids are primarily responsible for helping regulate blood calcium levels. And the exchange we make with that is phosphate. So I guess we could go back here since we've had that lecture on electrolytes. When the body saves a positive, it needs to get rid of another positive. So if blood calcium levels go up, if you have a hypercalcemia, you typically have a hypophosphatemia. If you had a hypocalcemia, you might have a hyperphosphatemia. So we trade those two hormones, or those two electrolytes. Okay, here we go with parathyroid. I guess the only thing I have is a fun story to go with this one. If you look at your notes, it talks about how if you have a parathyroid tumor or something, it could cause more calcium to be freed up to go into your bloodstream. That calcium is recognized as an abnormal waste product. And remember, calcium crystals might form together and form kidney stones. We talked about how like 70% of kidney stones were made of calcium. So I have two good stories. One, I think I already told you, my dad who formed kidney stones because he was drinking from the Tums bottle, essentially. He was taking large amount of antacids way past the manufacturer recommendation, and he developed kidney stones. Well, my mother developed kidney stones that were very severe and very large, and so the physician kept treating her for the kidney stones, and eventually they got smart and said, you know what, why is she forming these? So they checked her blood calcium levels, and they were very high, and they targeted it back to her parathyroid glands. She had overactive parathyroid glands. So how would you treat that? Well, similar to how we treated an overactive thyroid, they could do radioactive pellets, or in this case, they thought it was more practical just to remove a portion of her parathyroid gland. When she had that removed, I remember going to visit her after surgery, and her hands went into tetany. So her hands were contracted. They were squeezed down, and she could not make them open up. And if you think what happened, her body had gotten used to increased parathyroid hormone, that calcitonin, being released and causing more calcium to go into her bloodstream. When they stopped that process, her blood calcium levels dropped. And do you remember the electrolytes are important in nerve conduction? So she went into an abnormal type of spasm with her hands, and all they needed to do was give her a little bit of calcium to try and get those levels up. Over time, the portion of thyroid or the parathyroid gland that she had left was enough to regulate her calcitonin level so that she did not have to go on some sort of supplement. All right, so at the last page of your notes, on page 2, it says hypoparathyroidism can result from an injury or surgical removal of the glands, and similar to my mom, the symptom could be when blood calcium levels drop that they cause spasms or tetany, tightening of those muscles. Okay, now the adrenal glands, the cute ones that look like little hats on top of your kidneys. They sit by the kidneys for a reason. A lot of what they do is going to be tied into the sexual reproductive organs, so the testes or the ovaries, and the kidneys. These glands have a lot of blood supply to them, and we'll focus on some of the hormones that are released from there. We're going to focus on epinephrine and norepinephrine that's released from the adrenals. We'll focus on aldosterone or aldosterone, depending on which professor who you had and how they said it, and cortisol. We will not focus on the hormones that affect sexual characteristics, but we have talked now about two endocrine glands that can affect reproduction and sexual growth, and those would be your pituitary and your adrenal. Okay, so now let's go to some of these specific hormones. What happens when I have increased production of adrenal glands? If you look at the list, I want you to focus on corticosteroids and glucocorticoid. So can you find that in your notes under the adrenal gland? Can you find the piece that talks about glucocorticoids? And it says those are things that influence the metabolism of carbohydrates. So I bet you've seen the commercial on TV. The one that I can think of right now is the one that compares the woman and the man. They eat the same thing. The man loses a lot of weight. The woman doesn't. There are commercials that show you what happens when you're under stress and your body releases cortisol or the glucocorticoids, and it causes your body to save fat. And if you remember back to anatomy and physiology, if you have increased intake of carbohydrates in the form of glucose, if you do not use those, your body says, I can use these later, so I will store them, and it stores them as fat. And it specifically likes to store them as fat around your midline area. So keep that in mind. Now go down to serum cortisol. We can measure cortisol levels in the blood, and we can actually give you corticosteroids. These are the ones that are aimed at anti-inflammation. So there are patients who take steroids. Now I want you to look at this patient. This person is either on steroids or they have Cushing syndrome, which is oversecretion of cortical hormones, which include things like epinephrine and would include things like sex hormones and would include things like cortisol. When a patient takes corticosteroids or when they have hypersecretion of adrenal glands, they develop abnormal fat around their middle. It develops an abnormal fat pad between their shoulder blades. Some people call this a buffalo hump. If we could see the front of this woman's face, we would see that it's moon-shaped. They develop these little chipmunky cheeks when we give babies corticosteroids. There are some patients who, because of their disease state, autoimmune disorders such as lupus or rheumatoid arthritis, might be treated with corticosteroids. Babies with premature lung disease might be given corticosteroids. Patients might have a tumor that they don't realize they have. So we see some of the symptoms of corticosteroid problems or adrenal gland problems in patients who develop excess weight. We might check those levels of growth hormone. We might check your your thyroid hormone, so we might check your T3 and T4. And if you're heavy but you've been trying to lose weight, we might look at your adrenal function, so we might do corticosteroid. All right, the next thing I'd like you to consider is we're going to look at what else would happen. If you have increased production of epinephrine, you would have increased blood pressure. Do you remember that epinephrine prepares you to fight or flee? So when I have epinephrine released, I have increased blood pressure to prepare me to do that. What would happen to your pupils? Would they constrict or would they dilate? Remember, you need to be able to see better, and so your pupils dilate. Would you want your bowels to work or to kind of settle down for a while? The last thing I need to do if I'm fighting or fleeing is to have to go to the bathroom. So people who get nervous and say, that's a part of it, but that's kind of a secondary reaction, the irritability of the bowels. All right. Addison's disease. Can you find that under the information on adrenal glands? And now we've gone from an increased production of adrenal gland hormones to a decreased production of adrenal gland hormones. And that's called Addison's disease. This is another one that can cause changes in the pigment of the skin. Can you see the dark line in this person's nails? Or that they have abnormal areas of dark discoloration on their gums. They have increased discoloration on their hands. So this is not someone who's been working around a mechanic as a mechanic or something. They actually have increased pigmentation in these areas. What causes that to happen? Well, it is usually that there could be some sort of tumor. A tumor will normally cause increased production of adrenal hormones, but sometimes it could cause decreased production. And it talks about that she was treated with a medication that suppressed adrenal production. So let me kind of close this lecture with some case studies that would tie these together. And I guess before I go on to these, let me talk about one more thing under your adrenal glands. So you're at the bottom of your third page. It talks about a pheochromocytoma, and the reason I want to mention that is young people can have this type of tumor. It's most common in them, especially young men. We had a patient who came into a health fair, and they had their blood pressure checked by one of the students, and the student thought they had done it incorrectly because the person's blood pressure was so high, so we had someone else check it, and indeed the young man's blood pressure was very high. When he started to look, he had other symptoms too. He had a very flushed face. When asked, he said, yes, I do have problems with fairly frequent headaches. And so then we have some symptoms that are leading us to think that maybe he has this type of tumor. So think about a pheochromocytoma. It's a tumor that causes increased production of hormone release from the adrenals. So the person would have extra epinephrine. What would that do to their blood pressure? And do you see how that might cause the flushed face and the headaches because their blood pressure goes up? They could have the sweating because fighting or fleeing does increase your basal metabolic rate as well. The epinephrine would do that. It would increase your respiratory rate, and it can make you sick to your stomach or cause tingling in your extremities. And so he did have some of those symptoms, and he was diagnosed with a pheochromocytoma. The surgery is tricky because as they get in that area and start working with their instruments, as they touch it, you may have spikes in that epinephrine released from the adrenal. So they have to be really careful to watch the person's blood pressure very carefully. And once they are out of surgery, they usually have to take a little while to get used to sitting up again. Their body has kind of adjusted to that elevated blood pressure, and now going back to a normal blood pressure, the body actually has to acclimate again. Okay, now let's do these case studies. So look at the symptoms that we have. What's happening with the person? How would this tie into the information we've just discussed? So let's pick out the key things then. Enlargement of the left anterior neck. So he's noticed a bump or a lump there. He has an increased appetite, but he's not gaining weight, and he is having more frequent bowel movements. Now we have some more information about him. So his heart rate is within normal limits. 60 to 100 is normal for an adult. His blood pressure is really within normal limits for his age. The ocular stare and a lid lag. So ocular stare, the eyes are kind of pushed forward, and when he goes to close his eyelids, there is a slowing. They don't blink as quickly as they should, and can you imagine it's because there's pressure behind the eyeball. When the physician palpates the thyroid gland, they estimate there to be a tumor, a nodule. And so the questions I have for you, what do you think the patient's primary problem is? So tumors could cause increased production or decreased production of hormones. So which endocrine gland do you think is mainly to blame? And because it's the area of the neck, we're dealing with the thyroid or the parathyroid, but his symptoms seem to suggest thyroid hormone. When his basal metabolic rate goes up, he could be able to eat more without gaining weight. He would feel more hungry. He might feel warmer instead of colder. And what tests could evaluate the thyroid then? Well, we could do blood levels of T3 and T4. We could do a radioactive iodine uptake study to see if that nodule is metabolically active, a hot nodule or a cold nodule. And sure enough, they've done some results here. So here is his levels, and here's the normal range over here. So his thyroid levels, his thyroxine level is elevated. His thyroid-stimulating hormone is low. Now, why would that happen? And I asked you that question earlier and said it might be important. Look at his T3 and his T4 levels. His T4 level is high, and his T3 level is high. So would that correspond then that you would expect a low thyroid stimulating hormone? Thyroid stimulating hormone is like a big sister that tells the little sister or little brother, get to work, do your job. So if the little sister or little brother is already doing their job more than they should, better than they should, they're producing more thyroid hormones than they should, does it make sense that the thyroid stimulating hormones would respond this way? When we save calcium, so look at this person, they have an increased calcium, and I know we're not talking about parathyroid glands, but they're all in that same area. Look what happened to the phosphorus level. Oh, that one's actually increased too. So I guess you can have cases, remember there's two positives. There are other positives in addition to calcium and phosphorus. And the other one we talked about was not phosphorus, it was phosphate. So kind of keep those straight too. Okay, alkaline phosphatase, we talked about ALP. Look at the ALP levels have elevated. Okay, so we have diagnosed something wrong with their thyroid, and it's overly active. What are we going to do to fix it? Well, because they have a nodule, we're going to evaluate it for cancer. The good news is most thyroid cancer is really slow growing, and most of it is non-cancer. It will just be a nodule. They could remove part of the thyroid. They could remove that tumor, and that should decrease the thyroid levels. If they drop too low, then we just have the person take their supplement. Okay, here's another one then. So somatic growth, he's increasing in his male development way earlier than he normally should. His history is pretty much non-significant, except he has started to have signs of early development of his testes and his penis. He started to have problems with acne, pubic hair is already appearing. So can you think of which endocrine gland would do things like that? Would maybe have a role in testosterone, would maybe have a role in growth and development. Look at this. His height and weight, he's kind of off his height's been average, his weight was average, so he doesn't seem to be a growth hormone issue. It seems to be mainly sexual organs. So maybe we can kind of rule out the pituitary, even though it plays a role in sexual reproduction or sexual development. Do you remember the other one that did that? So we didn't talk much about the sex hormones released from the adrenal gland, but in this case where we're not having just issues with, this is not a boy who's off the charts with his growth and development, he was fairly normal with those. It's mainly the sexual development part. And so we're leaning more towards the adrenal glands. What tests could we order then? Well, we can test cortisol levels, we can test testosterone levels, and this young man, follicle stimulating hormone, luteinizing hormone, cortisol levels. So they focused on the adrenal glands and found that just parts of what the adrenal glands, part of the hormones that are released from the adrenal glands were abnormal. So to lower testosterone levels, one way we can do that is give you estrogen. Estrogen balances that out. His progesterone was already markedly elevated though, so we might start looking for an adrenal tumor or something like that. Okay, here's a third case study. Look at what her symptoms are. So menstruation has stopped. She's had a poor appetite and she's gaining. Even though she's has a poor appetite and cramps and diarrhea, she's losing weight. She has a lot of fatigue, so she feels tired. What do you think's wrong with her? So some of the symptoms then, the increasing fatigue, that sounds maybe like low thyroid hormones. And if you have low thyroid, usually you start to gain weight instead of lose weight. She has joint pain, muscle weakness, dizzy spells. She stopped menstruating, and with her, they ended up finding that she did have a pituitary problem. This tied in more to the issue of things like acromegaly, where her bones were starting to have some increase, and so she felt that joint pain as those bones were changing. So with her, they found a pituitary problem, and they did that by measuring the level of things like the pituitary hormones like growth hormone, follicle-stimulating hormone, luteinizing hormone. Here's a fourth case. So now I think you can see from comparing the last two, this case and the last one, can you see how this one's more typical of what happens if you have thyroid involvement? She has decreased energy. It's also started to affect memory. She has less frequent bowel movements, where the other patient had more frequent bowel movements. She's gaining weight. She feels cold even if there's warm weather. And additionally, she has a family history of hypothyroidism, and there is a type of hypothyroidism that can go in families. We have more information on her. Her heart rate is actually low. We said normal for an adult is 60 to 100. Her blood pressure, her diastolic number, the lower one is higher than it should be. For her age, it should only be in the 70s. She started to develop puffiness in her face, and her eyebrow hair, she notices, is becoming thinner. The thyroid does feel like it's enlarged in size, and her reflexes were abnormally active. So when they checked her knee with that reflex hammer, she actually had a higher kick than they should, but then they were almost like overstimulated. So do you remember how close the parathyroid is? And that regulates calcium with contraction and muscle contraction. So this patient, what test could we do to evaluate if we think the thyroid is the main thing to blame? And look at her levels. So her T4 level is normal. Her T3 level is elevated, or excuse me, it's within normal limits, I'm sorry. Her thyroid-stimulating hormone is very elevated. So do you see this high TSH? That's coming from the pituitary. And so it's taking the big sister in this case yelling at that thyroid to do its job. And so it should not have to be working that hard. Even though these are within their normal range, they are on the lower end of that range. And this increased thyroid-stimulating hormone doesn't mean that there's something wrong with the pituitary. It means that big sister from the pituitary, the thyroid-stimulating hormone, is really having to yell at that thyroid to get it to do its job. The reason they check this anti-thyroglobulin test is you can have, especially in that family history of hypothyroidism, you can have almost an autoimmune reaction to your own thyroid. And with her, she was diagnosed with a thyroid problem. Hers was underactive, even though she had normal levels, and we have this happen with patients. They put her on a thyroid supplement. Her weight stabilized. Her mood stabilized. She felt warm. So to wrap up, my husband, I told you, takes a thyroid hormone to balance out his body. How would we know if he's on too much or too little? He usually sees a physician about every 6 months now. Initially, it was much more frequently so that they could get that regulated correctly. But what kind of symptoms would he have if his level is too much now? Can you think that through? And what kind of symptoms might he have if his body's getting too little? And I think your notes and the case studies we've gone through could kind of help you identify that. So I will get your quiz posted, and I will get this presentation posted. Thank you.